Good morning, everyone. My name is Frank, and I'm from Tesla, a student in public health. Today's presentation, the research was about getting users' knowledge and attitude towards herbal medicine safety, and how that knowledge affects or informs their treatment option as to when they decide to go on herbal. If they are sick and they want to use herbal medicine, what kind of things they consider in terms of safety aspects before they go for herbal medicine. So that is today what I'll be presenting, and I do believe that by the end of the presentation, you will get something from it also. Please, can you go to the next slide for me? Can you go to the next slide for me? Now I have to operate it here. Okay. Yeah. So when we go to the slide two, we have the outline of my presentation, and it talks about that is the title, the introduction, the research question, literature review, and all that. As we can follow. So when you go to the third slide, it says the article, the title of the article as I just so the users' knowledge and attitude on herbal medicine safety and influence on their treatment options in Ghana is a qualitative study. So that is basically what the research was about. So the use of herbal medicine is widespread. Recent publication by WHO, it was talking about the fact that, especially in the developing world, close to about 80% of the people use herbal medicine or herbal medicine supplements either for entirely for their health care or to supplement whatever they are using. So herbal medicine is very, very widespread in Ghana also. And in the developed world also a lot are using herbal medicine. So, but one problem is that the patronage art is increasing. The knowledge about herbal medicine and what it can do, the negative side effects and possible drug herb interactions, that knowledge is not at par, is not increasing as it should, as compared to the way that the usage is increasing. And that raises a big concern because when we talk of pharmaceutical medicine, we know so when you buy a drug, we know when you buy paracetamol, we know the possible side effects, so you know how to manage, how to use it, and all that. But herbal medicine, though it has been over for long, that information are usually not available. Are usually not available. So herbal medicine safety and patients' medicinal knowledge is crucial in making informed choices on herbal medicine treatment options. So to have the knowledge about the possible effect, what it can do, even though it's working for you, the possible side effect, it's important to indeed help them in their treatment option and also for rational use, when to use it, how to combine if it is necessary, and all that. So it's very, very important. But as I said, not much information or data is available in Ghana on this area of healthcare. So the question is, are Ghanaians really knowledgeable about possible adverse health effects of herbal medicine? They use it a lot. We do use it, but is the knowledge, are they really concerned? Are they really informed about the possible effect that they can have on this herbal medication, even as many are using it, even as many are using it? And how does that knowledge, how do they use that knowledge to inform their treatment option if they decide to use herbal medicine? There are a lot of herbal medicines in the market, and one thing is that in Ghana you don't really need a prescription to buy a herbal medicine. You just, if you are sick, you just go to the herbal. Sometimes the patient decides which medication to buy, as to if he's having any stomach problem or stomach headache. You just go and buy herbal medicine A or B. So what really informs them if there are options to choose from? What really informs them to decide to go for A and not B, to go for C and not A? That is really what I was interested in this research. So patient medical knowledge and potential toxic effects and safety of herbal medicine is therefore crucial for two reasons. And the first reason is that, as I said, it helps reduce concomitant use of herbal medicines and drugs because patients usually do use it. And if they know that they could have a possible negative effect, they will manage the two, not to use them simultaneously or maybe to space them in order to reduce adverse drug herb interactions, because there have been a lot of papers on that, there's always an interaction when you use this medication. The paper presented by Iso and his colleague, it was about herb drug interaction. And for instance, um, a lot of common herbal medicines like St. John's wort has been found to interact with a lot of medication, even sometimes leading to bleeding and increased heartbeat and all that. And so having this knowledge is really important in that regard. And the second thing is that it also helps patients to make rational choices, as I said, as to which medication to go for. So the aim of the study is therefore to explore users' knowledge and attitude towards herbal medicine toxicity and safety, and how that knowledge informs their treatment options. Um, there are some few papers references. Some of them I listed here, which can be referred to or can be used for further reading. When we go to the methodology, I actually use this semi-structured interview guide, and there was a face-to-face interview which lasted for about 15 to 30 minutes. Um, Prior to this, users were given informed consent as to whether they will participate or not, and they have the free will and then to participate, and they were obliged to log out anytime they want if they choose to. So it was totally optional and totally free to join and free to quit in this study. And after the semi-structured interview, the transcripts were transcribed. Where they have, I had paper transcript, and it was supplemented with audio recording, which was later transcribed and then analyzed using thematic analysis. So that is the methodology. And choosing the sites, actually, I use random sampling to choose some herbal centers where the where participants were interviewed, and 10 participants were recruited for this study. 10 participants were recruited for this study. Some few, so in this study, there were some important outcomes or results that could be shared, and some of them, there was a belief that herbal medicine is less aggressive. So the first, the results were categorized into teams or act teams and sub teams. So I'll be talking about the major teams basically because of time, but it does contains the nitty-gritties of what came out. So first one was about knowledge on herbal medicine, safety and toxicity. It was an act team, and there was some belief that herbal medicine is less aggressive and have smoothing effect compared to allopathic counterpart. People believe that herbal medicine is not as drug as compared to paracetamol and all that, and it's less aggressive. So when you take it, you don't actually see side effects, and so it is really a factor that motivates many, and many share this opinion also. Herbal medicine are natural and could be taken with other bioactive compounds or products without any fear of adverse side effect. They believe that they are natural compared to any other fruit or vegetable we eat, and so we can take it with any medication without fearing any side effects. So it means that they don't know much about possibly what could come should it be taken with other medications together. So it means that they were lacking a little bit of knowledge in this regard as to possible side effects that could come out of it. And many informants had no idea whether they could be herb drug interaction, herb interaction, and herb food interactions at all. Many, when you ask them, so I had no idea about it. These were some of the outcomes that came out. So it's really a concern. It's really a concern. And so the acting tool talks about the fact that said attitude towards herbal medicine safety, and there's an acting. So what are their attitude towards this crucial topic, the safety of herbal medicine? So many have positive attitude towards safety. The fact that they are not knowledgeable about most of the side effects, there are certain things they are much concerned in terms of safety, not necessarily about whether it's going to give them a positive, but they are concerned about other things, which one of them was about fake medications in the market. They were a bit concerned that there are a lot of medicines in the Ghanaian market at the moment, and some of them are not genuine. Some of them are adulterated and could present a negative side effect. So they are much concerned about it. Many users share this concern. So the side effects are minimal. That is also another thing that they share. That side effects are minimal, even if there is, and there's no need to fear about that. And some informants were concerned about the labeling also. That some of the medications, herbal medicine, they don't have any information about the content, about
Mr.
side effects
Frank,
and all that.
Mr. Frank, sorry for the interruption. You have got 2 more minutes for the end of the presentation. So please do fasten your slides.
Okay, sir.
Yeah, please. Thank you.
So they are concerned about the labeling also as a factor. Also, the many users also they're also concerned about, as I said, the adulteration, a lot of medications in the market, and a bit difficult to know which medication to choose from, since those good medications do work effectively, but the adulterated ones or the ungenuine ones are not. So that is one of the concerns they share. So informants were asked about major factors that influence their decision to settle on a particular herbal method, which was actually the main reason of the main theme of the study. Some of the outcomes were that um, the fact that they said herbal medicines are safer than orthodox medicine. So it's one of the reasons that they also consider when going for herbal medicine that they are safer, so they fear not to about any other side effect. And the second reason is that they are cheap. The cost is also a big reason for them using it, and they are also effective. And finally, about the popularity of the brand in Ghana, a lot of herbal product companies can easily advertise their products, and so according to interviewees in this study, the more producers with enough facilities or resources to do a lot of radio advertisement, they are more likely to draw a lot of people to use their product. So not necessarily about effectiveness or about the cost, but about popularity, how popular the brand is. And the more popular, the more users use it. So herbal medicine safety had a smoother. They also concern, and it has a smoother effect or a minimal side effect compared to the allopathic, and some even use it concomitantly. So others were said that okay, it's not having any adverse effect, so I will use it to rather to control, to manage the side effect of allopathic medicine. So they'll use it after taking allopathic or orthodox medicine concomitantly, with the idea that they are using it to reduce the side effect of this. So discussion and conclusion that the users employed from the discussion shared, you could see that the knowledge about exactly what herbal medicine could do, despite the good benefit is emanating from the use of herbal medicine, is a bit low, even though some of the users were highly educated. It means that it is either the information is not provided at all, or they don't take keen interest in that. That is why they are not, because they could understand, they could read and understand if those information are there on the product. Um, Another thing is that, as I said, there's a lot of medication on the market that's shared by some of the users, and it really triggers a concern. So it's really an important thing to consider as to the authorities involved to bring some sanity into the Ghanaian market in order to promote and protect the safety of the users. Um, so really, herbal medicine is working, but from the study, we realized that there are some few things that needed to be done. As I said, one is about the sanity in the system, and the other is about the users that are not much knowledgeable about it. So there's the need for public education in terms of health promotion exercises to indeed to sensitize this area, to sensitize the users about the fact that herbal medicine is good, as they are saying, many were saying that they are effective. So you can use it, but to be aware that it could have a positive side effect, and so safety should be one of the reasons why they choose a particular brand, and also the authorities involved to bring some sanity into the Ghanaian herbal market. Thank you very much, and I may rest for some questions and answers, as I think it will bring much also into view. Thank you very much.